So welcome everyone to this Globe Op Talk. I'm Beena Venkatraman. I am the Globe's editorial page editor. And for those who don't know, Globe Op Talks are conversations that our editorial board members have with exciting thinkers and doers about pressing topics and important issues of the day. And today's topic, which is really a very pressing issue of the day, we are very lucky to have Dr. Eric Lander here for this Globe Op Talk. Eric is the president and founding director of the Broad Institute of MIT and Harvard. He is also the host of a new podcast called Brave New Planet, which I commend to everyone. And he was the co-chair of President Obama's Council of Advisors on Science and Technology for the duration of the 2 terms of the Obama administration, a time during which we worked together. So I'm also here in conversation with my former colleague, my former boss, really. And so we're going to talk a bit about some of that time in the Obama administration, among other things. But really what's on our agenda today is to talk about what's at stake when we don't trust science. And so Eric, thank you so much for making time for this conversation and for writing a great op-ed for the Sunday Ideas section.
Oh, it's a pleasure to be here. Great to see you. And as you said, we worked together for a long time. And so it's really fun to sit down and talk about science.
So we're at a very interesting moment in this country. And I really want to start by asking you about that, because to talk about trust and mistrust in science, it seems to me we are at a sort of staggering place in this country where there are people who don't trust basic public health guidance about wearing masks. There is a lot of growing mistrust in the idea of taking a COVID-19 vaccine. Is this Donald Trump's fault? How did we get here? How are we in this place where there's so much mistrust in scientific evidence?
Well, look, like everything, it's complicated. But I think one aspect is clearly leadership. Another aspect, I think, is communication. And on communication, I think many people have responsibility. But let's take leadership first. I think it's important to not be political about it because, well, here's the comparison. We have a Republican president in the White House. We have a Republican governor in the State House. Same party. I think the responses couldn't be more different. So it's not about parties. I think it's a mistake to think about Republicans this, Democrats that. I think the question is, when there's a crisis, what do you expect of a leader? And I think the classic things, whether it's about science or something else, is, you want to acknowledge the problem, you want to have a clear strategy, you want to communicate your strategy, and you want to bring everybody together. I don't think nationally that's happened. In fairness, I don't think the president's done a particularly good job. The response of the White House kind of makes my head spin. The White House has been at odds with its own scientists. That creates a lot of confusion. There's been a downplaying of the problem from kind of magical thinking that it's all going to go away or it's just the flu. And we saw that back in March, and we see it again today. The erratic response on shutdowns. We should be open by Easter. Well, it's up to the governors. Well, no, we're gonna say liberate Michigan or something. The casting doubt on statistics, like death statistics, that they're inflated. The idea that people can get tests when they can't get tests, or we shouldn't have tests because then we'd have fewer cases, so to speak. Advertising, pushing the ideas of drugs that haven't been tested, hydroxychloroquine, or in the thing that may be the most consequential, saying we should have a vaccine before an election can't help but make people doubt whether something more than scientific reasoning goes into it. So I am critical of the response because it hasn't had a strategy. But I contrast it to Governor Baker in Massachusetts. We haven't gotten everything right in Massachusetts. And I should say, I serve on one of the advisory boards for this. But the state has taken a pretty steady course of listening to scientific experts, making changes in response to data, floating things. And when scientists say, well, that doesn't make so much sense for this reason, usually backing off it. I think it's a real grown-up response. And I'm proud to see that it has had an effect. And I think most people in the Commonwealth of Massachusetts, they're pulling together. It's a pretty impressive joint effort. And I think leadership matters. But the other point that isn't just about, yes, sorry?
It's so hard to interject the way I normally would, but
interject.
And it's showing that Republicans can do science too, that believing in science.
It's not about party.
Right.
Republicans can do science just as well as Democrats. They can follow data and reason. And I think it's a mistake to think this is about party. I think it's about leadership. But I also want to be clear to say it isn't just leadership. I think we should ask whether, as a scientific community, we've been doing enough. Whether, when we advise something as a community, wear masks, don't have big gatherings, I don't think giving people rules without giving reasoning works. I think we ought to have some real respect for the fact that people need to understand the underlying reasoning. If you want to think about the pandemic, I think there are three things to keep in mind. We need to stop the spread. We need to deal with silent spread and super spread. So like those are the three things. Stop the spread. If one person gives rise to more than one new infection, it keeps growing. If one person on average gives rise to less than one infection, well, then the epidemic dies out. And so it's about using every trick in the book to decrease the number of people that somebody will infect. So distance, other things. Number two, this silent spread. Most people who are infected don't know they're infected because they don't have symptoms. And so, but they still can spread. So there's no way that you can say, I feel fine, therefore I'm not going to spread it. You wear a mask because you can't know. Because most people don't have symptoms. And then the super spread thing is kind of a little special to this virus. The difference of the virus level amongst people can vary by more than 1 million-fold. So some people have 1 million times more virus. Now, it means if you have a really big party, the odds of having a super spreader are much higher the more people you got. So the reason not to have huge parties is one person could infect an awful lot of people if you're unlucky enough to have a super spreader. So in some sense, I think we ought to have clear, simple conversations that say, here's what we know, here's what we have to do, here's the policies that should accomplish it. And, I think like many people were impressed by the Prime Minister of New Zealand, who went on television and just told it straight, including, when they didn't know stuff. And I think that inspires the kind of trust and confidence and collective action we need.
So I do want to return to the issue of leadership so we can, sort of dream about an alternate reality here. But before we do that, because you raised the question of the scientific community being able to do better at this, we have to acknowledge that there are other issues where there have been large swaths of the American public. I would say I'm going to pin this on Americans now because we are the populace that has had the longest standing and most skepticism about the science of climate change. We are not the only population that has anti-vaxxers, people who believe that there are links between autism and childhood vaccines. So this kind of skepticism and mistrust of science definitely predates the pandemic as well. And you mentioned the responsibility of the scientific community to be clear about what kind of the rationale is for taking different kinds of measures. Is that what's missing in those sort of other areas where we have mistrust of science? Is there something else to this? Is there a reason why this trend is emerging?
Well, look, it's tempting to come up with a single explanation for the problem, but when problems like this happen, there's usually multiple explanations. So when you think about something like climate change, climate change is real. It's driven primarily by excess carbon dioxide in the atmosphere. And if we don't do anything about it, eventually we're going to face hotter and hotter temperatures, which have big effects. Those are facts, but you know, they're uncomfortable facts for certain purposes. So they meet resistance. They meet economic resistance from fossil fuel interests. Just like, you know, saying that cigarettes caused cancer met a lot of resistance from tobacco companies. So in that case, you have organized, well-funded efforts to, you know, cast doubt or just vehemently deny. Well, that's one thing. When people have real economic interest to say, I want my business not to have to change for the next couple of decades. I know eventually it may have to change, but I'm gonna really go to war against those facts to delay. By contrast, when you talk about vaccines and autism, I think it's a somewhat different thing. I think there are times that science does not have answers. Why does my child have autism? Someone might ask. And the right scientific answer is usually we don't know in that case. We're learning more. There's genetics that are coming and becoming clear. When we say we don't know, people then want answers. And sometimes if we're not able to reach and connect with people who need to know and believe and trust that we're saying, we don't know, we're looking, there's some evidence here, they want an easier answer. And I think sometimes people will prey on them. So I don't want to equate those two sort of things. I think there's also times that science just plain overpromises, that scientists want to make sure their story gets on the front page of the Globe because it's really cool. And to do so, the scientist and maybe the reporter want to make it sound even cooler that this might cause cancer. Might cure cancer. Have to correct that. And then maybe the might gets dropped out, and people hear that, oh, this is gonna cure cancer.
Right.
And then we see scientific things that don't always pan out. You know, the internet's great, but you get fake news. Social media is, you know, supposed to bring us together. It can tear us apart. So I think there are many things. This compact between science and society that started after World War II, it's super powerful. It has produced so much good, but over time, we're seeing there are a lot of places it gets frayed, and I think we have to take each of those seriously in its own right. And to your point, scientists have to be totally straightforward. When we don't know, we should say so. When we get something wrong, we should say so. And, you know, in this political environment, admitting an error seems like a ridiculous thing to do. Who'd admit an error? But that's what makes science strong, because it knows that if you admit errors, then your foundations are strong and you can build on them. And this is tough because it doesn't fit with the just yell louder or deny everything kind of thing. But I think science has to stick with it, but science has to also know that it has to listen to people. It can't just complain that people are scientifically illiterate. I think that's not a respectful thing. I think it's a question of, how do we actually connect to bring people along with a way of learning things about the world that's pretty powerful? And science starts with humility. And so scientists better be humble.
Okay, there's a lot there. I want to return to the idea of the compact between scientists and society, but I do want to talk a little bit about the Obama administration, since we were in the belly of that beast, you co-chairing PCAST, the Council of Scientific Advisors, me as your policy advisor. And in those years, we got to see some interesting things. And I mean, it strikes me, I had a headline flash across my screen, you know, about the president on the campaign trail right now, current president, attacking Tony Fauci, who of course has been a longstanding, for decades, Republican and Democratic presidents, including Obama, expert on infectious diseases. And just to kind of talk through and imagine, because I'm sure you've been thinking about this, I think about this regularly. How would this have been handled during the Obama administration? We know from H1N1 and Ebola response, very different diseases, very different kinds of outbreaks and scope. But we know that things were handled differently. Do you have any, do you hallucinate about this too? Do you think about, you know, what would have happened if this happened under the Obama years and what that kind of response would have looked like in the US?
Well, you know, I try not to spend too much time hallucinating about what might have been about many things. But I do think it's worth looking back at what happened, just factually what went on. H1N1 flu, sometime around February, I think, 2009, there were cases in Mexico of this influenza that had jumped from pigs. It's a swine flu. And by mid-April, I think, we had the first couple cases in the United States. And there were suggestions from Mexico that it might be much more lethal than the typical flu. Now, it turned out not to be. But what was very interesting was watching people swing into action. All of the health agencies got together very rapidly. And then I remember getting a call, I was traveling, that the president wanted the PCAST, this council of advisors, to come together. And he said, I know I got these great health agencies. I want you guys to look at what's going on and tell us what we're missing. And by the way, I'd like a report in 2 weeks. Took us 2.5 weeks, but oh well. And everybody dropped everything and they went and met with and thought about, and we wrote a report with some suggestions about how we could get a vaccine faster. And it actually wasn't changing the science. It was running things in parallel that normally would be run one after each other. We figured you could run them in parallel and make things faster. And it ended up being the case that, 5 months after the first US case, the first vaccines were approved. Now, that was a flu vaccine, and there's a lot of experience with flu vaccines. Coronavirus vaccines, a different thing, much less experience with such sort of things. So I don't want to equate it. But there was kind of a quick whole of government response. And in the end, I think it's fortunate that something like 12 or 13,000 people are estimated to have died from that, which is like dramatically lower even than the typical annual flu. You can't credit the response entirely for it. I think the response was very helpful. It also was just a less lethal virus, but you didn't know that at the beginning and everybody swung in. And then the next year, what was very interesting was, we at PCAST got asked to stand up another quick report on how we could make vaccines even faster. And so a second report of how do you accelerate this? I think it was approached in a steady way. And admittedly, it was an easier virus. But what I look at was that kind of steadiness and also willingness from the beginning, from the White House down, to say, if we're doing something wrong, just tell us. I think I'd love to see more of that going on. I think the same things happened with Ebola. It's obviously a much harder thing, but I think there are so many, unforced errors, as they would say in this one. So many own goals on this that made our response less good than it should be. But, this pandemic is not an easy thing no matter what. So I don't want to pretend anything's easy in this stuff.
Sure, but it just strikes me the mobilization of external scientists to give advice, right? And then to make that public facing, to make the advice and the guidance public facing in a way that currently, right, we know that there's interference with the CDC. We know that there's been attempted interference with the FDA. And just to have this kind of body that worked both with government, advised the White House directly, but also communicate with the public about what those recommendations were in a way that the public could then decide whether the daylight between what the White House was doing and what the leading scientists in the country were recommending was something of concern to them.
And Bina, from mutual experience, that there were instances where what the advisory council wanted to say was not, say, popular with what some agencies in the government wanted to hear. And in every such case, the White House came down and said, the advisors have free rein to say what they think. Doesn't guarantee people are going to follow it, but never did anybody think we should change what we advised because it was not necessarily going to be well received by some agency.
Exactly. And often it was giving cover to those quiet voices that now we see come out in whistleblower reports or come out, right, to leak to the press that they're concerned, right? PCAST could actually say, this person has a really credible idea. We're going to give it the spotlight. Anyway, I have a little bit of a what if the counterfactual comes to mind.
No, I'm much more interested in what do we do for the next pandemic? How do we get this right?
We'll get there. We don't have a lot of time.
The last one. So carry on.
We need to move on. But it's good to kind of have people understand, I think, who haven't been in that role of advising the White House on policy and related to science, to understand that there is another way possible. There's another way of dealing with this kind of information.
Just look at Massachusetts. I think
Yeah.
Massachusetts is an equally good example. This is totally bipartisan. It's possible to be totally bipartisan with this.
Diplomatically put. Okay, and so I want to turn a little bit to your broader ideas. So you've just launched this podcast. The Globe Opinion section is happy to be a partner with you on this. But this is really an idea you've had for a while. You've been thinking about this idea of Brave New Planet, utopia or dystopia, I think is your tagline. And
Yep.
you're looking at a number of emerging technologies. And most recently you have this episode about deepfakes, these digitally created, very often realistic ways of portraying people, portraying personalities, actions. So I want to try to understand from you, sort of, tell us why you made this podcast. Tell us what do you feel are the insights about this issue of trust in science, trust in technology, that are raised by some of these technologies that we are seeing come to the fore right now, really in an election cycle?
Well, look, why make the podcast? I think fundamentally, because I think this compact between science and society is so important. Science and society have to work together, have to trust each other, have to understand each other. And some people would say, oh, the problem is that society is not scientifically literate enough. I don't think teaching people, sort of science courses in that kind of way is going to be anywhere near as good a way to engage people as having people try to grapple with real problems. So I think if we want a society that takes seriously what science is about, let's give them real hard problems that make it interesting to learn about it and make it clear that the scientists don't always know the answers, and therefore we need the society on board with this. So we picked 5 problems. One of them is these deep fakes, as you call them, where it isn't all just downside. I mean, the deep fakes, they're incredibly creative synthetic media that allows all sorts of art and movies and other things, and even therapy for paralyzed patients is being advanced through this amazing creativity, or things that would write stories for children in their own dialects and about their own communities, all sorts of cool synthetic media that also has this dystopian effect that you can create, fake pornography involving a person. You can do incredible political damage. You could try to cause international misunderstanding and harm and war. What do you do with a technology that has both sides? Well, the first thing is you better understand it. And then you better go figure out where are the levers to control it. You could say, I don't want any of it, but then you're giving up something. You could say, I'm just going to shut down the bad parts. Well, good luck. How do you figure that out? Every one of these episodes is trying to put forward something that starts from amazing science and technology, and that we all have to think about. And so I picked things where I don't have some, predetermined answer. I'm not sure where I sit. And I think that's where scientists and the rest of the world should be talking, in places where we know we're going to need each other.
So this is really interesting, because I think part of what happens when the public gets afraid of one of these technologies, or legitimately concerned about a new technology, whether that's genetic engineering or whether that's geoengineering or deepfakes, is that it seems that the technology has already been developed by technologists, or even starts to have an impact in society, like deepfakes. And then it's sort of like the public learns about it, right? It happens sort of after the fact. And you're saying part of how you build trust, I think if I understand you right, is that people need to be engaged with and wrestling with the societal consequences of the technologies, with the same problems that the scientists are wrestling with themselves. Do you see a way for that kind of wrestling that you're trying to introduce with the podcast episodes to actually enter the practice of science and technology development, so that it's not right? It's not the case that these conversations come to the public after the fact, but that they actually influence the way that they're developed?
Well, yes. One is making sure people engage in the problem. I'll give you two examples. One, the last episode of the podcast is about something called gene drives, a new technology, one of the many technologies based on CRISPR, this genome editing technology, that would allow a gene to be spread throughout an entire natural population. You could add a gene or knock out a gene, and in principle, you could wipe out a species. Now, the leading use where you might want to limit a species would be to limit malaria in sub-Saharan Africa by causing mosquito populations to crash. Well, none of that's been approved yet. It's still 5 years off before anybody's going to consider the approval. But there's a group that's working to be able to do it and also trying to work to engage people in, should we do it? But of course, that same thing could be used on Martha's Vineyard and Nantucket for Lyme disease, to get the ticks that cause it, to get other species, invasive species. And we ought to be having conversations because we've got 4 or 5 years, maybe for some of them 10 years. And it's not one of these things that's all good or all bad. Maybe in some cases it's okay with the right kind of consent, but maybe there are other cases where we don't. So that's one where I think we ought to be out there comfortable talking about these things, saying the science is cool, the scientists are aware of the potential problems with it, they're working on ways to make them safer, but we got to get everybody engaged. But the other is right close to home, the vaccine for the coronavirus. Do we just want to have an advisory committee to the FDA pronounce this vaccine is blessed or this vaccine is rejected? Recommending approval or disapproval of a vaccine. I don't know. I haven't tried this on any of my friends at the FDA, but why not couple the process to what I guess on Reddit is an Ask Me Anything, an AMA, and make sure that the data are presented in a way that's completely understandable to folks. It's not so hard. Let's say one of these trials has 30,000 people, half getting vaccine, half not getting vaccine. You wait till you get 100 cases, you find out if it was an equal number of vaccinated and unvaccinated people, the vaccine was kind of useless. If everybody who got infected didn't get the vaccine, then the vaccine offered a lot of protection. Or more likely, it's somewhere in between. And is it protection against infection, mild disease, severe disease? What about, is it protecting older people? Is it protecting women? Whatever. There's nothing that complicated about laying out the facts and maybe figuring that the process should also have folks in the public asking questions. I don't know, it's stuff like that seems to me important to building trust.
It does. I mean, that is an interesting idea to have some of the scientific advisory panel for the FDA be talking directly to the public in a way that maybe, they don't. I know they have public meetings with public records, but in a way that allows the public to actually interrogate the process and what we understand. I mean, one of the things that's exciting to me about the COVID vaccine is that, aside from the sort of fear that's being raised by Operation Warp Speed and sort of the framing of that, and the president obviously talking about rushing it before the election, which we all know based on where the trials are now would be too soon. But is that there are these new platforms for vaccines, the mRNA platform that has been brought to the fore and could potentially revolutionize how we make vaccines in general. And that story, that part of the story is kind of being lost. Now, we of course don't know if it's going to work out. We don't know if it's going to produce the best COVID-19 vaccine. We don't know if it's going to become something that becomes scalable for distribution quickly. So what are your thoughts on, just building trust in it, as thinking of that as an emerging technology, not just the fact that we need to build trust in a vaccine once we get the vaccine, and then making sure the data on safety and efficacy are shared with the public, but just how do we help people understand the technology itself and whether that is something that they should trust or what aspects of it they should trust, and how we understand its risks?
Yeah, no, it's amazing how rapidly it's been possible to develop vaccine in a vial. So let me be clear. This mRNA vaccine, or two companies are making them, the first one made took 2 days to design. You get the sequence of the virus, you design it because it's made out of an RNA matching the genetic material of the virus. It took about 2 weeks to produce some of it. That's actually, true for a bunch of the others. It takes a little longer, couple months, but making a vaccine, producing a vaccine in modest quantities is not the limiting step anymore. I think these new technologies are really cool, whether it's the RNA or some of these proteins or other things. The hard part is testing it. The hard part is we don't have some, gee whiz scientific way to take that vaccine and in the matter of a couple of weeks say, will it be efficacious? Will it be efficacious for everybody, for some people? How protective is it? Will it have a side effect in one person in 100, one person in 1,000, one person in 1,000,000? I think the next frontiers are to figure out how can we get surrogates that predict, never perfect, but predict efficacy and safety. So I think all of this, again, I fall back on transparency. That's always been the most important thing in science. When there is an adverse event in a vaccine trial, as there was this morning reported for J&J, people should be totally transparent about what was the event. Adverse events happen. They happen both in the vaccinated and unvaccinated. It doesn't mean it's due to the vaccine, but it might be. And so the more transparent you are, including at the end when you're asking people to look at the decision about whether to take it that each person will make, and they say, oh yeah, 15,000 people got the vaccine. 3 had a certain side effect amongst the vaccinated. And by the way, 1 had it in the unvaccinated. What does it mean? What should I do? Well, people are smart. They understand that there's risk attached to everything. And they can say, if the data are laid out clearly on the table, that's a risk I'm willing to take or not willing to take. And I think the more we can do that, the more the public will come along. And the more we either obfuscate it scientifically or color it politically, we're going to lose trust.
So, Eric, I like this picture of human nature and the public that you're painting, but I have to tell you, I think I told you the last time we talked that I've been reading this book, Carl Bergstrom's book, The Evolutionary Biologist, Calling Bullshit. And he and Jevin West, who's an information scientist, make this argument. And I actually asked this to Pete Buttigieg because he has a new book out on trust last week when we were talking in an op talk. And the question is sort of, is it true that what we want people to have is trust, or is it actually that we need people to be better informed skeptics? Because I think one of the challenges here, and I would take responsibility of this in the media as well, is the outlier, the story about the outlier who gets reinfected with COVID-19, for example, or the story of the outlier with the adverse event becomes often a story that carries more public sentiment, and so that skepticism about let me look at the number of people who've received this vaccine and let me look at the number who've had adverse events and make that decision. I worry that a lot of the population doesn't actually have that, and what we need is to kind of instill that kind of skepticism. What do you think?
Look, when I say trust comes from skepticism. So that's where trust comes from. What I'm trusting is I'm not trusting you, Bina, to make the decision for me. I'm trusting you, Bina, to tell me the facts. So I need that. I need to know you're not covering it up, and therefore we can't cover stuff up. And then if I'm trusting that I have got to see the data, the information, that you're not covering anything up, then I skeptically look at it and I say, well, one person had a really terrible outcome. How do I know that wasn't due to the vaccine? And you, Bina, the scientist, says, we don't. This could be a super rare side effect, and we won't know till we've looked at 1 million people. That's trust because you're transparent. And then somebody can say, okay, she's not trying to pull the wool over my eyes. Maybe it is a super rare side effect. On the other hand, there's a much higher chance I'm going to get infected. So I'm going to take that risk. You take a risk every time you get in a car, you put on a seatbelt because it helps. It doesn't absolutely protect you. It helps. We recognize people still die with seatbelts on, but on average, they do better. So I don't want to be Pollyanna that this all goes away. And I certainly don't want trust to mean just blind faith. That's not what trust should be. Trust should be, we have a serious conversation where I'm getting the facts and I'm getting them in a clear enough way that I can make a sensible decision.
Fair enough. So you talked a little bit about this compact between science and society when we first started this conversation, and sort of that had been your idea that this has been established in this country, or there had been such a compact after World War II. And you make this argument in your Globe op-ed, which ran in our Sunday Ideas section, and I commend to everyone. Can you say more about that compact? What is this compact? Is it actually something that existed on paper? How should we understand it, and how do we get it back if that is indeed what we should do, which is what you've argued?
Well, it sort of existed on paper in a certain way, not exactly in a signed contract, signed by science on one signature line and society on the other. But after World War II, the science advisor to President Roosevelt and then President Truman, Vannevar Bush, pretty much pivoted and said, look, science was critical in winning the war. Radar and atomic bombs and penicillin. We're going to need science in peacetime. And the way it's got to happen is universities and research institutes, we have to have science as a public good. We're going to fund science, and we're going to let science discover things and technology figure out how to do things, and that we don't exactly know what's going to come, but societal benefit. And so lots of amazing things came out of that. Internets and human genome projects and many, many, many other things came out of having, the world's greatest investments in science, and it done in a kind of open, public good kind of fashion. I think the issue has been all of these things I mentioned before that have really gotten that tattered, that sometimes it may gore the ox of an industry, and the industry is going to push back super hard because economically it matters too much to deny a piece of science. Or, well, let's look, the fruits of science are not evenly distributed across society, right? It's the middle of the country doesn't get so much, and people of color or women are underrepresented in very serious ways in both the doing and the fruits of science. And so, and these other things I've talked about where science may overpromise or things may go off the rails, all of these things eventually accumulate over time. Any brilliant idea, like this compact was, eventually gets complicated. It gets sand in its gears. And it's time to stop and ask, what's not working? What is working? And, there's some things that are just not negotiable about science. This insistence on moving cautiously, having evidence, admitting error. If we give up on that, we give up on the whole enterprise. But the idea that we need to engage the public in some other way than just saying you should have taken science in high school, we need to engage people in a really respectful way, to understand when we say something as scientists, what do people hear? It's not enough that we said it right if it isn't heard in a way that makes any difference to anybody. And so I think if we talk about science education, we could equally well talk about scientist education. The scientists have to get educated about, how they communicate with the world in ways that really matter and address problems that really matter. So it's those kind of things that I think after, what is it now, 75 years, seems time to go in, dust it off, and think about what parts need to be refreshed.
So Eric, the time is flying by, which I'm not surprised by, but I would be remiss if I didn't get any audience questions in.
Okay.
And you did bring up the Human Genome Project, which I think everyone who's watching probably knows that you were the principal leader of the publicly funded part of the Human Genome Project, or that aspect of it, and responsible for that. And I do, this question that came in, I think kind of relates to that, because it's sort of the reader's asking, your insistence on decoding the human genome being public and not proprietary knowledge seems like an example of what can be done to create trust in science. And it sort of raises the question of the privatization of scientific knowledge and whether you think that's at odds with building trust. And I am curious about your answer to that question too.
Well, look, I mean, the privatization of scientific knowledge is a bad thing. The privatization of some aspects of science is not. If you want to develop a drug and it's going to cost you $300 million to run a clinical trial, it may be that the right thing to do is go have that funded by investors. I don't mind that because in fact, there's this partnership between public goods and private goods, public investment and private investment. The knowledge part bothers me. I think the Human Genome Project insisted that we put the data on the web every day, freely available for everybody, including that private company that was competing with us. They should have it too, because that was the principle. Knowledge should be public because it drives a lot of things. Even when you file a patent on something, the point about filing a patent is you must disclose your invention. You must teach the world in order to get a 20-year monopoly. So scientific knowledge almost never should be kept secret.
Well, let me ask a little bit of a harder question, because we're seeing, if we take Facebook, for example, right now, it's been, right, Mark Zuckerberg has really taken a lot of heat, and I think some of it, in my view, has been appropriate because he built this tool, he built this platform and a set of algorithms that drives people, for example, to groups that might be interesting to them. If they are gun collectors in Michigan, they might suggest to them a militia group that then wants to kidnap the governor, for example. And we know that this has had a huge impact on sort of the spread of misinformation and problems for our democracy. And the information itself, right, the platform is open and free, actually, but the ways in which those algorithms work and drive particular kinds of information to be shared, or the way that technology is influencing us, is not completely transparent to us. Yet there is obviously a successful business model built on it. So how do you reconcile something like that? Where's the responsibility there? And is it fair for the public to distrust scientists and technologists in instances like this?
Well, I mean, this is why laws exist. We should be able to pass laws that say certain things have to be disclosed. You could say, oh, the pharmaceutical company shouldn't have to tell you what's in the vial, what's in the pill, because it's a trade secret. No, we don't allow it. We don't allow you to sell that pill unless you disclose exactly what it is and what all the data were, et cetera. If it were to turn out that some aspects of the internet are as damaging or lethal or something, there's no reason the Congress couldn't say you have to disclose the algorithms. You know, this is within the power of the Congress under the Commerce Clause to say disclosure is required. There are other things, you know, as noted in the podcast, these companies have protection under law for false things and damaging things that get said on their platform, because they're not responsible for policing that because of Section 230 of the Communications Decency Act. Well, you can tweak that too. These are choices made between the public and the private. The private is incredibly important in this country. We need the private sector, but it doesn't mean the private sector gets a blank check on whatever it wants. There's always a striking of balance. There was a time that pharmaceutical companies, 100 years ago, sold patent medicines that cured whatever ailed you, but usually didn't. And we changed it. We got to keep updating these things.
So we're running very low on time, but there was a question about faith that a few people asked about faith that I thought we should just maybe end with. So
simple question.
The reader asks, our overly polarized and tribal society seems locked in a win-lose battle over what constitutes fact and truth, and the conservative side seems to place more value in moral religious truth than in scientifically demonstrable truth. What can science-loving folks do to bridge the gap without denigrating others and without dismissing them as stupid or poorly educated?
Which doesn't work, right? So I think it's important to find the common ground here. And there is a common ground that runs through the podcast. We refer to the listeners as the stewards of the brave new planet. I think in religion, particularly actually in Western religion, there is a concept of stewardship, that there is a stewardship over the earth. And I think that is the right place to start. Most people, wherever they're coming from, they care about the outcome for their children, for their communities, and they want to be good stewards. And I think most scientists and most people who come from a non-faith perspective, at least the decent ones, want to be good stewards also. I think that's a pretty big meeting ground to have these conversations. And then we can ask, what will harm our planet? What will harm people? What will save lives? And build out from that. And what do you see in that? Because I think everybody can learn from each other on things like that.
Eric, thank you so much. I have so many more questions than we can get to today, and I'm sure others do too, but I hope that they tune into your podcast and check out, the Globe's going to be publishing op-eds on all of the subjects of the podcast episodes. So right now we have a couple of really lovely pieces on deepfakes, important and compelling. Thank you for joining this Op Talk. Thank you, Eric, and thanks to everyone who tuned in.
Thank you, Bina. Pleasure to be here.